And with that, I will go ahead and begin. I am Darlene. I am the National Digital Sales Director, and I also host our podcast with SeniorLivingGuide.com. A little bit about SeniorLivingGuide.com is we have 4 statewide publications. We have a publication in Florida, North Carolina, South Carolina, and Virginia. And then we also, unbeknownst to a lot of people, we have a hospital publication, or hospital directories, I should say, in 13 states and in 40 markets. So that has been growing significantly in the last couple of years. It's just really kind of taken off. We also have a national reach website, SeniorLivingGuide.com, which provides leads for communities, for home healthcare companies, and it's also a great resource for different types of senior outreach that might need some more lead generation or just some branding. So if those are things that would be of interest to you guys, please feel free to reach out. I can see if it might be a good fit for you guys. And then also, as I mentioned, I host our podcast. We have a podcast that is a senior resource and caregiver resource focused podcast. We just went into season 2. We have almost 4,000 downloads. It can be found on Spotify, Amazon. Apple Podcasts is probably our most downloaded podcast or application, or really anywhere. So please go check it out. It's an amazing resource for seniors, caregivers. It's just chock full of really great information, and it's not super clinical. So it's something you can sit back and enjoy and get some really, really good information. And that's pretty much all I've got, but I would really like to introduce Brian Dickerson, who is working in the lab today. So you guys are super lucky that you get to see the whole lab side of it. So I'm going to let him go ahead and introduce himself, tell you a little bit about what we're going to talk about today, and let him go from there.
Thank you, Darlene. So again, I'm Brian Dickerson. I'm with Star Manufacturing and Doctors Hemp Solutions. I'm also a lawyer. The weird combination came from 25 years of practice in law and representing physicians, pharmacies, and small pharmaceutical companies. And in doing so, in 2014, which I'll talk about a little bit later, the Farm Bill allowed for the growth of hemp in universities and agricultural departments. And from that, I had clients that were interested in manufacturing products from a pharmaceutical standpoint, doctors prescribing, and also manufacturers who wanted to actually make the dietary supplement versions of the products. And what basically happened over the years is many of my clients, my physician clients who wanted to be able to use, whether it's the CBD or full spectrum hemp, they were buying products on the marketplace, and the products that they were utilizing were not necessarily in an efficacy that they wanted. And so with that, combined with some of my pharmaceutical clients, we got together as far as what can we do to cure this, and this is what we have. So I also have a ranch. So my ranch is 20 miles from our facility, is extraction facility. So we had room to grow hemp. On our property right here, we grow the hemp, we extract the hemp, and we make the product for the end consumer. And so I'm going to go through details on the cannabinoids, hemp, how it's evolved, what products you need to look for, what you need to look for when you get in products, and I will get this going. All right. So the premise of this is understanding why hemp and the cannabinoids can assist the residents and patients when they're using these products, why they're helping them, and then some cautionary concerns. The main concern is going to be when your patients and residents are utilizing the products, where the products purchased from, are they actual viable products, and do those products have any effect on the medications that the patient is actually, or resident is taking. What I will tell you is when you talk to a lot of physicians, the endocannabinoid system, which we're going to talk about here, wasn't taught in medical school because it didn't exist in their minds. The schools did not teach it. The schools are now just teaching the endocannabinoid system. And that endocannabinoid system is what enables the cannabinoids in hemp and in marijuana to help people. So
I have a
when you
question
look,
for you. I'm sorry, I didn't mean to interrupt you, but I'm not seeing a screen.
oh,
I thought maybe you were going to load it and then you started talking, and I'm
yeah,
realizing I thought you maybe had your, there we go.
loaded now. There we go.
There we go.
Okay.
Yeah.
All right. Thanks, Darlene.
That's okay. I thought you were going to start sharing it, and then I realized you had started going into it, and I'm like going, okay, so I think that's wrong.
So here we go. So what I'm going to go over is just a little bit of the history of hemp, difference between hemp marijuana, fiber and cannabinoid hemp seed oil, the cannabinoids in the hemp plant. There's not enough time to go over what each cannabinoid does and what the benefits are, but we're going to hit it. And there's going to be links on this website that you can go and research on your own. We'll talk about the endocannabinoid system and then go into the products. But going back to the fact that a lot of practitioners, there's a lot of, I would say, nurses and physician assistants, and there are some physicians that are really into the benefits of hemp and marijuana. The problem is the education process and learning. For a lot of physicians and a lot of healthcare practitioners, this is something new and it's complex. And so to get some people to change, it's difficult. You also hear the people just thinking that marijuana and hemp, CBD, full spectrum, that it's just snake oil, doesn't work. And with all candor, there's a lot of product out there that is snake oil that isn't going to help and is expensive. And so you definitely have to do your research on the products that you're utilizing. But in doing so, I'm giving this presentation as a lawyer and as somebody who is in the hemp business, from the extraction facility, growing hemp, and actually making them products, working with our doctors and our pharmacists to actually make the product. I am not diagnosing, I'm not giving any medical advice or opinions like that. But when I get the resources on here, if you are ever looking for the guides, we have them on here for you to be able to do your research. And when a doctor or a physician says, you know, I don't believe in hemp, there's not enough studies on it, it's because they haven't studied it, because there are tons of studies on it. So I'll get a little bit more into that when we hit to that slide. But when you look at cannabis, cannabis has marijuana and hemp. The hemp plant during the colony times, per the king, each colony property owner was required to at least grow 100 hemp plants on their property, then expanded up to more than that, and there was 10 acres grown on property, because hemp was used for everything that we know, the old school hemp, that's being fiber, that's being rope. We got new uses for it now. But what then ends up happening is that paper, fiber, rope, it gets in conflict with new businesses. And so in 1937, you have the Marijuana Tax Act. It did not make hemp or marijuana illegal. It just asserted a tax on it. And it was a very innocuous statute. When you look at the historical references, a lot of people didn't even realize it was passed. But why it was passed is to initiate a tax on anybody still using hemp for rope, because it affected DuPont Company, because they just got their patent for nylon. It affected the timber companies because they had just figured out how to use timber and wood for paper. So the lobbyists, like in anything in today's world, the lobbyists controlled, the big money controlled, and they issued this tax. Because of that tax, the hemp business started sliding away. Then you have World War II. And then you have the Narcotics Control Act, 1956. And that listed marijuana as a narcotic, not like a controlled substance later on, but as a narcotic. So here in the United States, hemp was fading away real fast. Marijuana was then, instead of being a product that was used for medicinal purposes, because it was throughout the 1800s and early 1900s, it was then becoming illegal. Then you have the whole scare of the reefer scare. And marijuana in the United States changed considerably differently. What is different, though, is in Israel, and you have Dr. Ralph McLeod, he continued to study. And he's actually the pioneer, the godfather of cannabis. He is the one that did the groundbreaking research to discover the actual CBD and THC cannabinoids. And he started studying all the cannabinoids. He is the one that is developed and credited with developing the entourage effect. 1970, United States, Controlled Substance Act adds marijuana, which includes hemp, to a Schedule I drug. Schedule I is your morphine, cocaine, heroin. What is remarkable about that is when it was actually enacted, you have the Assistant Secretary of Health and Scientific Affairs saying, yes, we're going to add it to Schedule I right now because we don't have data on what it should be. When we complete this data, then we can remove it if we need to or leave it on if we want to. What happens is that data is completed in 1972 and it recommended marijuana to be decriminalized in 1972. And Nixon and Congress ignored it and it stayed as a felony and a Schedule I drug. What changed, though, is in 2014, of course, from the 72 to 2014, you have many states then allowing for medical marijuana. You had some with recreational marijuana that continued to grow. And then what you have is the need for everybody wanting to be more green. Well, what can be more green than instead of making a plastic fork, can we make it out of hemp? Since all the science in the United States was obliterated in 70 and 72 because of the Controlled Substance Act, they didn't know. So 2014, the Farm Bill signed, and that is what then kicks off hemp again. And that's what kicks off the universities and the state ag departments selecting whether or not they want to participate and go forward with the hemp. As you probably can guess, the states that jumped on it in 2014, Colorado, Oregon, they're considerably ahead of the times than other states. Florida did not jump on board in 2014. Southern states, Mississippi did not jump on board, but Mississippi participated with the DEA marijuana test. But a lot of states did not participate, and because of that, it grew at a slow rate. But what did grow was the studies. All of the scientific studies, not only with Israel and the Czech Republic, but the United States. That's continued to grow. Marijuana medical research continued to grow. And so in 2018, you have the Farm Bill passed, which extended the 2014 Farm Bill for higher education departments of agriculture and made actually hemp a legal substance. 2018 December, it took hemp off the controlled substance list. It excludes it as a illegal drug as long as it has 0.3% or less of THC in it. And that is the defining factor. So what is the difference between marijuana and hemp? Marijuana is still illegal by federal standards. Or states can legalize it for medical and recreational marijuana. State of Florida, it's medical. California, it's medical and rec. We can go throughout the whole list, but we are growing. We're over 50% of the states are allowing it for recreational. Over 3/4 of the states are allowing it for medical, medicinal. Marijuana, as far as the medicinal marijuana, I'm not talking recreational, medicinal marijuana can have up to 30% of its content THC. And that THC is going to be Delta 9. That Delta 9 THC is the high factor in marijuana. Marijuana does contain some CBD because the CBD molecule is attached to THC, but it will have more THC than CBD. When you look at cannabinoid hemp, the difference is it has more CBD, more CBG, the cannabinoids. The THC level should be 0.3 or less. I say should because when we get to it, the hemp that we're talking about, the cannabinoid hemp, is really a hybrid. It's the hybrid of marijuana and the industrial hemp. So there is some cannabinoid hemp based upon circumstances of nature, seed, environment that can get hotter than 0.3. It's called hot in the world. And when it's hot, it's deemed illegal. And under state laws, the majority of state laws, you have to burn it and get rid of it. Where most of us believe that you should be able to harvest it and just take the THC out. Because in the lab that I am right now, we can take THC out of marijuana. We can take THC out of hemp. We can remove it completely. But the laws are differently, and most states say if it's over 0.3, you've got to destroy it. So the big difference is hemp, you do not get that high. Marijuana, you get the high, and that's because of the THC Delta 9, and there's no limitation on it. Now, when you get to hemp, when you look at that picture on the left, that is your fiber hemp, what's truly industrial hemp. That is what you make paper out of. You can make wood materials. So there's flooring made out of it now. There's decking made out of it. Instead of having plastic forks and plastic paper plates, you can have hemp. It really can and will change significantly. When I was over in Spain in 2019, what was remarkable is the inside of the cars are not plastic. They're hemp. And Spain's been using industrial hemp since the 80s. So you go inside the car, it's made out of hemp. The roof tiles in Spain are not whatever fabric you want to make from over here. They are made out of hemp. They're lightweight and they're strong. Hemp wood from the industrial hemp, the fiber, is actually 50 times stronger than oak. So there's a lot of benefits of the industrial hemp. But when you look at industrial hemp, the only really thing it has as far as a nutritional value is its hemp seed and the hemp powder from crushing it for humans. There's debate on whether using it for animal feed, and it's got a benefit in animal feed, but it does have anywhere from 15 to 25% protein. So it is a high protein powder. But when you're looking at products and you see something that says hemp seed oil, that is not coming from the cannabinoid hemp. That is coming from fiber hemp. So that hemp seed oil does not have any cannabinoids in it. The fiber hemp is cannabinoid free. If it does have cannabinoids in it, then again, it's a hybrid and it's going to have that flower on top. So when you see the picture on the right, that cannabinoid hemp, it has that flower. That flower is what is key to the CBD, the CBG, growing all of the actual cannabinoids. So there are versions of hybrid fiber and cannabinoid hemp, but the still rule pertains that it's going to have less than 0.3 THC. That is the legal definition of hemp. The only thing that I want to point out is the cannabinoids we'll talk about, isomer we're going to talk about, and acids. But what it gets down to is that 0.3 or less delta 9 is what defines hemp from marijuana to make it legal. The issue we're having right now legally is the definition of isomers and acids, and I'll hit it here shortly. Here is a basic diagram of cannabinoids. When you look, again, this is not me saying the medical ability and mental and health effects, but these are some of the research as far as CBD, what it can help. CBG, lower blood pressure, bone stimulant. CBC, antifungal, anti-inflammatory. There's some that say CBC has a greater anti-inflammatory than CBD. When you go over to CBN, that's kind of a blend between the THC breakdown to CBD. But there's just an example of some of the benefits that these cannabinoids have for human health, animal health, and wellness. And you'll see I've got links on all the PowerPoints in blue. Those links are active, so you can actually go directly to the websites where I'm citing that will give you more information, and especially when we get to the clinical studies. So the cannabinoid hemp has phytocannabinoids. That's what's in the plant. That's what attaches to the human's endocannabinoids and the endocannabinoid system. So CBG, you probably have heard probably in the last 2 years more of that than CBD. CBG is that first hemp cannabinoid, and it starts first, and then as the plant grows, it fades off and turns into the CBDs and the CBCs as the plant matures. CBG, though, has significant benefits, and the key thing about getting a CBG is finding the plants that have the CBG in it and or harvesting your CBD plant early. So one of the things that we do here is, since we grow our own hemp, we can control what hemp we want, what type of hemp, CBG, CBD, when we harvest it, because then we can get the benefits out of the plant that we're looking for our client's end product. So CBDA, and I just talked about the acids, that A stands for acid. So every cannabinoid has an acidic partner, an acidic cannabinoid. And that acidic cannabinoid is what the plant starts off with, that cannabinoid. And as it matures, that acidic acid then sometimes changes into the actual cannabinoid or stays in its form and state. So plants that we harvest, and we've got a plant that we use that has significant CBDA, 12 to 15% CBDA. Sometimes we use that plant for actual products, whether it be horse products, dog products, or human products in capsules. Other times we want to convert it to CBD. And the way we convert it to CBD is with our CO2 extractor, and the temperature that we use gets up to 165 to 175 Celsius. When we're actually doing the distillate, that creates the CBD out of the plant. When you heat it at 125 degrees Celsius, that then changes the CBDA into CBD. So there's a lot of science behind this, but it's fascinating to me, these temperatures and how they can change the acidic form into CBD. But here's the unique thing. They're discovering that CBDA has better qualities and better properties than converting into CBD. And I've got a site later for you guys to look at. But going back to the natural plant, most likely has some of the better benefits than when us humans decide to mess around with it and try to change it. CBD, like I said, is transferred from CBDA into CBD by temperature, or it does it naturally in the plant during the maturation process. CBD has been studied most because the majority of hemp plants have high degrees, high percentages of CBD in it. So that's why it has been studied more. The CBCs and CBNs they're more like minor cannabinoids. They're not as obvious. So you have to get a plant genetically to do it or convert those CBDs into the CBN and or CBC.
Yeah, I've never even heard of the other ones. I've only heard of the CBD. So, I mean, I think this is super interesting.
Yeah, and with that, the CBD is so popular that majority of people market it as just CBD. So people didn't even know there was anything other than CBD. They didn't understand it was hemp extract or a cannabinoid. They just thought CBD was some type of product.
Exactly.
And when I talk about Epidiolex here in a bit, that's what you're probably seeing more on labels, hemp extract, full spectrum, broad spectrum. It's because the FDA granted Epidiolex as an active drug ingredient, a drug, in 2018. And then so the FDA was saying to everybody promoting CBD, the only way you can promote CBD is if you get an FDA approval. And all these products are dietary supplements. So the dietary supplement, you don't have to get prior FDA approval as long as you're at an FDA registered facility and you're using good manufacturing practices. So you're right. You probably never heard of these other cannabinoids at all. But we're going to talk about them real quick. THCA is that acidic form of THC. It's in every plant. It does not have the psychedelic effect. But again, with temperature, heat, and the plant growing, THCA can be converted into the delta-9. And there's several deltas within the THC plant, but delta-9 is the one that is the psychotropic, the high. THCA can also be converted into good benefit. You don't always have to convert it into the delta-9, either by nature or by using the lab. The delta-9, that is what gets you high. So when you hear about THC itself does not, but the THC delta-9 molecule is what gets you high. And the more THC delta-9 you have, the more high you will get. So most medicinal THC will not be all the way up the point, at the 30%. It'll be less, 5% up to 10%. The THC binds with the CB1 receptors in the brain, and the CB1 receptor is part of our endocannabinoid system, which I'll hit here in a bit. But the delta-9 is the key factor for high. When it's in hemp and it's under 0.3, you're not getting that high. You could smoke as much hemp as you want at 0.3 and you're never getting high. So we always have people joke, well, aren't you worried about people coming in and stealing your hemp? And of course, we don't want anything being stolen, but people, if they smoke the hemp, they're not going to get high. So good luck. CBC attaches to the CB2 receptors, and it's being found that it attacks tumor cells. And the studies are finding that it attacks cancer. So beyond the fighting of tumor cells and cancer, it's also found that it actually develops brain cells. So a lot of the research right now with CBC is dealing with anti-Alzheimer's therapy, dementia therapy, and they're finding great results with that. CBN is when the THC molecule starts to break down after age. The CBN, the reason I put this up here is because the CBN is being developed more for helping people sleep and relax, because it does have that THC effect that lets you just kind of chill. joking like the Beavis and Butthead chill effect. That's what CBN does through the conversion from a THC aging into CBN, but it is a valid cannabinoid in the plant. Delta 8. This is where a lot of people, if you go online, type in Delta 8, you do the search. We have a product that has Delta 8 in it, and it has great results. It is a THC. So the negative about using Delta 8 is if you work at a place that says, if you test positive for any type of THC, you can be terminated unless you have your medicinal medical marijuana card. That is an issue because Delta 8 will hit a positive definitive THC test. Now, if that does happen, depending upon your employer, your union, most tests will then go to a quantitative test that will quantify whether that is THC Delta 9 or Delta 8. And Delta 8 is permitted by a lot of employers, but you need to check with your employer on that. Delta 8 is a conversion from Delta 9 through the CBD cannabinoid to Delta 8. It is legal and lawful. It is controversial right now. And the problem is, going back to what I said at the beginning, there's a lot of product out there that claims to be something that it is not. There's a lot of CBD oil that says it's CBD oil when it does not have the right amount of it. With this here with Delta 8, unfortunately, there's a lot of labs out there that are not remediating the Delta 9, and there's a lot of Delta 9 left in the Delta 8. And when that happens, that gives you that Delta 9 psychotropic high. So when I go to the end of this presentation talking about QR codes, if you are looking to buy Delta 8 for a resident, family member, or if a patient has Delta 8, the QR codes, which unfortunately only a handful of states require, and the federal government has no requirement on it, those QR codes tell you exactly what's in the product and how much D8 it has and how much D9 it has. But from the D8 perspective, I have family and friends who have been on either Ambien or Trazodone for years and could not find any relief other than those controlled substances to fall asleep and to rest. They are now using Delta 8. I will also give this caveat. Do not use Delta 8 if you're planning to do anything within the next 6 hours. It's not like you're going to get high, but you will be very relaxed and chilled. And it's just like if you drank 3 scotches at night to go to bed. Do not do it. The endocannabinoid system. What is important about this is that is what your body is receiving the cannabinoids. So you have these CB1 and CB2 receptors in your body. The central nervous system is all over your body, accepting in the cannabinoids. The easiest way to describe it is you got pluses and negatives in your body, and that is your nervous system, your endocannabinoid system. After beating up your body, whether it be hard day at work, mental, physical hard day, exhausted, those positives turn into negatives. That's your endocannabinoids, it's your CB1, CB2 receptors. When the cannabinoids come into your body from either a full spectrum hemp product, or if you just take direct CBD or broad spectrum, when those come into your body, they go back and they turn those negatives into pluses. And so I hear a lot of people like, well, I've been using CBD for 2 weeks, or I've been using full spectrum hemp for 2 weeks, and I don't feel a difference. If your body has been out of line or out of whack for a long time, it's going to take a while for those cannabinoids from the hemp plant and the product to actually get your endocannabinoid system back in place. Once it does, then you'll start feeling the relief. Some people feel it right away, but that's just one thing I always hear that people need to be aware of. The thing that's interesting about the endocannabinoid system is for you, the people that work at the nursing home, skilled nursing, retirement, assisted living, you need to talk to the physicians. If your physicians are not necessarily aware of the endocannabinoid system or think it's some farce, it was actually started in the research back in 1895. But then in 1988, that's when the breakthrough came about as far as discovering the CB1 and CB2 receptors. And it's way too long. This could be an hour-long webinar long as well, just talking about the endocannabinoid system. But if you hit that link down there below, you can definitely research this, and it'll give you all the information as far as the chronological events in the endocannabinoid system, and then the studies currently and how the cannabinoids from hemp and marijuana actually revitalize your endocannabinoid system. And that's when you hear like this anti-inflammation. Well, CBD, full spectrum hemp can help you with that. That is true. And it's because the cannabinoids are going into your body, and where you have in your endocannabinoid system inflammation, they attack that and they reverse it. They're not going to reverse it all in whole or permanently, but that's how the process works in a very general explanation. This is what I have for everybody to just be able to do your own research on your own time. But I again give this to you because the National Institutes of Health has all of this information on their website. You go to the PubMed, NIH.gov, and you put hemp, cannabinoids, whatever you want, you'll have hundreds of articles. So when you hear people say, well, there's no studies on it, there's no research on it, they haven't done their research, because when you go to this website by yourself alone, you will find a plethora of information. But I mean, you're seeing in these articles about anti-inflammatory properties, helping with cancer, going back to a COX-2 inhibitor. And that bottom one is very interesting because it actually shows how CBDA, that acidic form before it's converted, actually acts as a natural COX-2 inhibitor. So it actually acts like a natural non-steroid anti-inflammatory drug. So your ibuprofen, but it's coming to your body naturally. The other websites I have on here, the Cannabinoid Clinical just gets into the clinical aspects of each cannabinoid. It's very good. It'll break them down more than what I just talked about because you're going to have more time. And the ICCI Science, the impact of that is the Czech Republic website. And that Czech Republic website has articles going back to the 60s. It is awesome for research and for actually understanding the research going on with cannabinoids in the health world. Green Unicorn Farms is just another good cannabinoid guy. I've got at the bottom with Dr. Ralph McLean, the godfather of CBD. Now they're calling him the godfather of CBDA. So even though he started this research in the 60s, he's not done. In 2017 through 2019, he was doing the research specifically on CBDA. And what he is concluding, and the evidence is concluding, is that CBDA in the natural form can be, and for the most part, is stronger than just your CBD oils. So that natural state of CBDA has the antidepressant, anti-anxiety effect without even converting it into an oil. And I've got the site at the bottom. That is him specifically talking about his research on CBDA. Real quick, the benefits of cannabinoids. This link, I think everybody will want to review, especially dealing with today. This came out this week. BioRx IV has completed a study. It still doesn't have the peer review, but it used data analysis from the University of Chicago, so a respected university. And what they have discovered is that the CBD cannabinoids actually attach and replicate to the SARS-CoV-2, COVID-19 cells, and in the study, it stopped the reproduction of those cells. So this just came out this week. You can go to the link. You can look at the scientists behind it, well-respected scientists, well-respected university, but it is showing how a cannabinoid can stop with the reproduction of virus cells. So it's very interesting. CBD and active drug ingredient, Epidiolex. I mentioned this earlier. June 2018, this becomes the first drug approved by the FDA with a cannabinoid in it, CBD, or the CBD cannabinoid, that is. Now, the difference between this drug and what you buy as far as tinctures, oils, creams from whether a website, your stores, wherever you prefer, is the Epidiolex, to give you a reference, for a 150-pound person. The recommended daily dose is 750 milligrams a day. So 325 twice a day for a 150-pound person. The product that we have used and that our doctors have recommended, that we work with our doctors with, are 1,000 to 2,000 milligrams for an entire month. So it goes to show you that this drug, like with everything, when you look at prescription grade Tylenol versus over-the-counter dietary supplement Tylenol, lidocaine 1%, that's what you go to the pharmacy to pick up. If you want stronger, over 5%, then you get a prescription. But this is the Epidiolex, which started what everybody thought was a great positive trend because the FDA is recognizing the benefits of cannabinoids. The negative is because of this, this is when the FDA sent out all the warning letters in 2018 and 19 to people selling CBD. And they said, no, 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 CBD is an active drug ingredient and you cannot promote it unless you have FDA approval. The FDA is still in the process. After the Farm Bill was passed in 2018, they still have not came down with any of the regulations on how to enforce the cannabinoids, specifically CBD. There's all kinds of rumors for the last 15 months that they were going to, they being the FDA, have a guidance of if you're less than 5,000 milligrams per month, that is, then it's an over-the-counter or maybe a dietary supplement. But that has still not came out. So that is why probably a lot of you recognize the change from your product being a CBD product to then seeing a full spectrum or a broad spectrum product. Now, after Epidiolex and after the great benefit everybody thought about the FDA approving a cannabinoid, what you then have is a bunch of studies being performed, an analysis on what's actually out there on the street and what products are being used. And this is where, from a skilled nursing, assisted living, retirement center, where family members are bringing in the cannabinoid products, the hemp oils, CBD, whatever they may be, this is where you have to be careful because you have no idea what those patients are actually taking. So the biggest thing that is a scare is when you actually see products out there that don't have CBD in it when they claim they do, which there's the California Attorney General did studies a few years ago. And again, products that said they had CBD had some or no CBD in it. Some that said they had full spectrum had some of the cannabinoids, but did not have full spectrum hemp. So the QR code is the key, and I will get to that in a bit, but make sure you know what's in the product because there can also be pesticides and metals. The one thing about hemp, it's used as a remediation plant, that industrial hemp, because what it does is it sucks up everything that's in the soil. So if hemp is planted at a mountain base and that mountain base has nickel, any type of iron in the ground, that plant will suck it up. So I'll show you in a bit here what to look for when you look at your COAs from your product when you buy it on the QR. So this is what we do from soil to oil. We do everything from planting, picking the seed, planting that plant. That's a picture of our crop from this past May. The flower that comes off that plant, then we dry that flower. After we dry that flower, we then mill it. We've got all of our equipment's pharmaceutical grade. We have a pharmaceutical grade mill that takes that plant and it looks like flour, F-L-O-U-R flour. It's just green flour. From that green flour, it goes into our CO2 processor, which is a pharmaceutical grade CO2 processor. And based upon the temperatures, those temperatures create the crude. That crude, then we take it a step further. If it's going to be full spectrum hemp, it goes through a distillation process. If after distillation, we want it to be, if a client says we want CBD or we want CBC or CBG, then we take it and we isolate through temperature that actual cannabinoid and create the isolate. And then you have the final product that we end up creating either for our clients or for the doctors and healthcare practitioners we work with so that they can actually determine what they want. And I mean, that's the one benefit. Since we control all this, we can tell the healthcare practitioner when that plant was planted, what type of plant it was, what the temperature was in the ground. We have a total forecast of what we have as far as what we provided as far as water and nutrients to the plant during its 90 days or 180-day life, when we harvest, how we harvested, and at each stage we test the plant so we can show the cannabinoid levels and how they grow. Most importantly, show how there's no pesticides in it, no metals, no other chemicals. Wow. When we go through the CO2 processor, same thing. Everything gets tested afterwards. When we get to the oils, everything is tested. So the one thing that we can do, and this is part of the basis of wanting to do a pharmaceutical grade, is that we can show the product end user what kind of plant it was and the quality all the way to the end. So there's no doubt or question, does it have this amount of full spectrum hemp in it? Does it have this amount of CBD in it? And does it have any chemicals? We can show that the entire time. And this is why. We're an FDA registered facility. We're certified good manufacturing practices. We use our third-party QR code. We're doing that before it was even going to be required. Our QR codes are on the product, but our QR codes we can also provide for our suppliers, showing exactly everything that I just described from soil to oil. And then we're also state registered programs. So in the state of Florida, it's Fresh from Florida. Texas has a program. California has a program. So different states have programs that you have to show that the product is completely coming from those states. So we have that as well. The example that I have on the right is one of our cooling creams, and you'll see the QR code right there. What I'm going to show you is what that QR code ends up showing. But that third-party testing, you take your phone over, your smartphone over that QR code, and it'll pop up the actual information. I do want to say this. Don't make the assumption that all products are made at an FDA-registered facility. Don't make the assumption that all facilities are GMP approved. They're not. We were looking to do an expansion in Colorado, and I'll just say we were looking at Colorado. I went to the facility. Not only we learned that it's not FDA registered, well, since it's not FDA registered, it's no way going to be GMP approved. And it was really scary, the different products that are being made in warehouses and not labs. So don't make the assumption. Make sure you do the research on the company, provided that they are GMP approved. And don't get me wrong, there are great companies out there. There are a lot of companies like ours that do soil to oil and control the whole process, and that's the way it should be. But for the companies that are not, this is what they're doing. They have a broker that buys hemp from a farmer. They pay that broker 15%. They're paying that farmer a profit. Then that extraction facility that just paid that amount makes the product. Then the companies that actually making the end product is paying a broker to buy the extracted product, the crude, the isolate, the distillate, and they're paying a broker. So you got all these middlemen. You basically got 3 middlemen involved, and you also have no control quality involved. Right. Because I can tell you, we've had people try to sell hemp to us, and then we get this third-party test, and we see what their third-party lab says, and notice that we've really never heard of the lab. Is it ISO accredited? So we have product of theirs that they're proposing for us to use. We send it over to our lab in Miami, and they come back and tell us that not only does it not have the CBD quality, but it doesn't have the actual necessary control steps, in fact, because they have chemicals, pesticides, and they also have heavy metals. So that is what takes it to the next level. And it's just so great that we grow all of our hemp that we don't have to worry about that issue.
Wow.
So here's that third-party code on the left. That's actually on the products. And again, buy quality products. That's all I'm trying to get out of this. I think our product's the best, but buy quality products. Make sure they have a QR code, and then you hit that QR code, and what happens is you get to see the COA. So you can see the COA. This is actually on some biomass. You can see the total THC level is 0.178. The legal limit is 0.30. Total cannabinoids, CBD 8.89. Total cannabinoids with CBD in the minors, you can see that there's a little bit of CBGA and CBG in this product. It could total of 10.21. Now this, I'll be honest, is not the greatest hemp product as far as cannabinoids, but it really depends on what the client is looking for. Some clients like a lower CBD quality with other minors, and so this is an example of that.
Mm-hmm.
When you look at
this is so great, because so many of these folks that are on the call have patients, and then they have clients if they're working in home health. They may be taking these products, and some of them don't know what they're actually buying and what they're taking, so they can help their residents really understand some of the products that they're actually putting in their bodies or on their skin or whatever the case may be. This is incredible information. Yeah,
and this one, Darlene, is the one that's very important. That's the one that shows you the pesticides. Those are all the pesticides they have tested. And I'll be honest, when we do our tests, we do the full panel testing. There are facilities that will only do the cannabinoid test or some pesticides, but you want to make sure everything is being tested so that you can make sure that there are no pesticides in the product. And then when we go to, I just went over it, the microbials, mycotoxins, and then the heavy metals. And the heavy metals, and I'm just saying this, if the hemp is grown near mountains, near elevation, then you have to look for arsenic, you have to look for lead, you have to look for mercury. I had a client out west who was a farmer who did a great job of growing the hemp. It was gorgeous looking hemp. We went to have it tested, and it had high lead and high mercury in it. Nobody would even buy it. So then what we had to do is we had to put it through the extraction process and extract those metals out of it. That cost a lot of money. So that farmer's hemp product was devalued tremendously. But this is the information you need to be able to look at when you're actually deciding what you want to have as far as a product and put it in your body or putting it in your patient's body.
Absolutely.
Here's the three categories: full spectrum, broad spectrum, isolate. So you hear CBD, that is that CBD isolate. That is just the CBD cannabinoid. There's no THCs in it. There's no minor cannabinoids. So I will say it is a benefit that it has no THC because it's isolated out. There's also CBG isolates and CBC isolates. So it's all depending upon what you're looking for to take care of your body or from a facility, what the patient needs. But I would just say this, a lot of family members don't understand what the different benefits are. They see CBD, they buy it, and that's what they give their family member. Where on the left, you have the full spectrum. The full spectrum includes all the major cannabinoids, THC, CBD, CBG. It also has the minors, the CBC, CB, it can have some CBN, and then the CBDAs, the acidic forms. That's what's called the entourage effect. And going back to Israel, that's what they discovered in the 60s is the best. The way to easily describe it, and it's not scientifically accurate, it's just an analogy, is if you take an all-purpose vitamin, which has all your vitamins, a multivitamin, or do you just take vitamin D? When you take just vitamin D, you're just taking care of one issue in your body, and that's fine to do because that may be what you need. But when you take the multivitamin, the full spectrum, you're getting the benefits of all of the cannabinoids and the terpenes. Because when you do a CBD isolate, you're removing the terpenes. And again, the terpenes would be for another webinar, but the terpenes definitely help the body. Tons of science on the smell of the terpenes assisting the body. The broad spectrum, why this is important is truck drivers, again, some nurses, people that work at healthcare facilities that are not allowed to have any THC in their body. The broad spectrum includes all the major cannabinoids, your CBD, CBG, except for THC. The process is removing the THC from the product. So during the process of making the distillate, the THC is then burned out and taken out. And so you just have that distillate, the final oil that has the other cannabinoids, but no THC in it. It should include the minor cannabinoids. Some minor cannabinoids may be burned off in the process of taking out the THC, remediating it, but it should have them. So I would always recommend, and not medical advice, but when you're just looking to supplement your body, full spectrum for everyday use. If you want to do an isolate, and if that's what you and your doctor thinks best, that's great. But if you're someone that cannot take THC because of your job, you do have the benefit of broad spectrum. Delta 8, I hit on it earlier, but the key about the Delta 8 is it's supposed to contain less than 0.3 Delta 9. And so before you use any Delta 8, make sure you check the QR code, make sure you check the lab to make sure that it is less than 0.3. We've purchased product that's Delta 8, and some of the Delta 8 had 17% THC in it. Some had 5 to 10% THC in it. So the process of Delta 8 is very complex in the science world. So just make sure you definitely include some research before you start taking Delta 8. And remember, never drive after Delta 8. Give yourself 6 hours. Here's the different manners in which the cannabinoid oils, the hemp cannabinoids can be utilized. A sublingual, which is underneath the tongue. The reason you do it underneath the tongue is it absorbs it quicker, or if you swallow it, and I know a lot of people try to swallow it. When you swallow it, it's going down your digestive tract, and then it's being consumed by your digestive tract before it actually affects you. So having it actually sit underneath your tongue and absorb underneath your tongue is the best. There are also capsules. We have capsules, and that, of course, is being digested by your gastro system. The roll-ons, that's the perfect where you have pain in a specific space. You can actually just use the roll-on and activate it in the location where you feel the pain. That's more of an oil. And then the creams, there's a variety of creams. Ours is a menthol cream, but there's a variety of creams that we can do for clients, from skincare, derm type creams to pain creams. This one on here is a specific pain cream that gives you the relief. And this, I guess, coming to the end, these are, again, just 4 of our products of many, but if you are a facility and if you want to make sure your clients have the product that they really need and make sure they're not taking products that may be harming them, you can have your own product. You can have your own label. There's nothing that's stopping you from doing that. We can do that for you. We can make sure that's cannabinoid oil products that are quality, free from pesticides, medicals, and chemicals. It's made from an FDA registered CGMP facility. You can either do your own logos, your own brands. We can help you with it, but we can work with the resident's physician or the doctors you're working with and come up with formulas. There are some formulas we have for certain clients if they had turmeric, glycosamine, and the actual tinctures. We have no problem doing that. We just work with the doctors, and we have our doctors and pharmacists work with your physicians, your doctors, your healthcare practitioners. And to be honest with you, there's a lot of LPNs, CNAs, RNs, and nurse practitioners that I think are more involved in the cannabinoid world than the general population of physicians. And we work with them a lot on what they want for their patients. So we can work with you. And like I gave the example earlier, we cut out 3 middlemen. So those products right up there that you're seeing, the oils, we sell those oils retail for 30 to 40 bucks, 40 because of the Delta 8, but 30 to 45 bucks. You go to buy these same products online anywhere else, they're 90 bucks to 100 bucks and even $200. We're talking 2,000 milligrams of full spectrum hemp. So you definitely want to look at who your suppliers are, not only for quality, but also for cost savings. And there's my contact information. Anybody has any questions, our website's there. You can look at our website. I know this is more towards humans, but we've got great equine, horse, and dog products too.
I've seen what happens with your dog products. They actually work.
Yeah.
You have some little black lab puppies that were like zooming, that were just like chilled after. So, and they enjoyed little treats.
Yes, they did.
So I really want to thank you. I think this is such great information. As I mentioned before, this is becoming more and more mainstream versus even what it was just a few years ago. I think it's super important to understand you really gave us nuts to bolts on this, which I think it's super important because it really is something I didn't know a lot about. I just had, the basics, and I was very misinformed, to be very honest with you. You taught me so much because I really had a different outlook on it. And now I really am a little bit more buttoned up in my knowledge, and I can have better conversations with people when we do talk about this. And one thing I did want to mention on some of these products, I mean, at the end of the day, you can walk into like a 7-Eleven or just a gas station, and they have these things for sale. I mean, I'm sure the ones that have the higher THC, I'm assuming these are not in most states, but clearly I'm assuming that they're probably not high quality, but people don't know that. And that's like the big game changer here. And just kind of having this conversation with you, there is a difference in quality that's really, really important that I don't know that I completely thought about. But being able to access that through that QR code is, to me, it's a huge, huge game changer. And when we're talking about what we want for our seniors, for their residents, what they want them putting in their bodies, they need higher quality product. Everyone does, but you really want to make sure, because they may not be paying attention, that's kind of we're their advocates. So we need to really make sure that they're getting the best of the best. So
yeah, I mean, and I'll just add to that, Darlene, is state of Florida requires the QR code, and you're having Indiana and other states adding that to their requirements. But what you're seeing is, I would say, the high quality manufacturers of the product, are wanting to, because they sell in Florida, like, we're going to keep this label, this QR code on all of our products, wherever we sell it, because it does distinguish them from other competitors. And it's a great thing that the state of Florida actually has that required.
Yeah, no, I'm with you there. Did anyone have, I only had, let me see if I had some questions. Anybody have a question that they would like to ask Brian? Because we would love to take some questions. Here I have. Eastern Shore of MD here. I would like to know the legal side of administering medical marijuana, especially if your residents are on the Medicaid waiver. Also, who can give it to them? We own an, this was a long one. We own an assisted living and the nurse comes in as needed. We don't want to lose any government funding we receive, but our residents would generally benefit from this. Any advice?
Okay, so on marijuana, it's going to be state to state specific. So depending upon what states you are in, the patient, if they have their medical marijuana card, their medical marijuana training, whatever it may be in that applicable state, they can still get medical marijuana. As far as not having funding for it, the funding is not going to be prohibited because the patient has elected to utilize their medical marijuana. So that's, but it is state to state specific on what can actually be done, whether that patient has to have their outside physician, because not every physician has gone through the medical marijuana training in each state. Like in Florida, by way of example, the physician has to actually go through training and be qualified to dispense or prescribe, medical marijuana. Not every doctor can prescribe medical marijuana. So that is the key with medical marijuana as far as state to state guidance. You're not going to lose funding for a Medicaid, Medicare patient if the patient is the one choosing that that's what they want. So that's the key. Your patient, remember, your patient still has the right to choose in your facility what they want to receive. When it comes to the benefit of hemp, and that's why I think it's great for nursing homes, is because the patient can't necessarily go out and find their own medical marijuana doc. I highly doubt that a lot of medical marijuana docs are coming to your facility, but the trend is growing. But the hemp product, the CBD, has the cannabinoid benefit, and that there's no issue with federal funding at all, because that is completely legal, legitimate product. You don't have to worry about state funding or federal funding being interfered with that. And you could actually have it at your facility and provide it to your patients, not have to necessarily worry about your patient going outside your facility to a medical marijuana physician.
Yeah, and then I have a comment and then I have another question. So the comment is, thanks for helping them understand that there's basically a difference versus going online and buying, not quality products. So there's that comment. So thank you. And then the question is, for back pain, what would you recommend, sublingual or oils?
All right, I'm not a doctor, so I cannot advise, but I would just say this: sublingual every day is recharging your endocannabinoid system. So it's like taking your multivitamins, which is really helping your body. And then if you have acute pain, then you take what feels best on that acute pain. So that's the way I can answer it legally.
Heard. Gotcha. Okay, anyone else have any more questions or comments they would like to throw in that chat box before we sign off here? Nope, just have a couple thank yous. All right, I think that's going to be it for us, Brian. And just to let everyone know, I will be sending out the link and then also the slides with this presentation. So please be on the lookout. That will be coming into your inbox. And if you have any questions, you'll also have Brian's contact information in that email as well. And you can reach out to him and my contact information as well. Until then, everyone, have a great day. And thank you so much, Brian. We really enjoyed this. So much great information.
You,
thank you.
Thank you.